again for one more YouTube live. I hope everyone is joined, and so then we can start early. So today I also have one more case with you to discuss. It's a very interesting case. Again, a case of hypercholesteremia. The cholesterol was high, and with the treatment it came down very significantly with homeopathy. So I hope everybody joins in early and we can start a session. Before that, we can take some questions on the WhatsApp so that we don't waste much time. So one of the questions on WhatsApp is, so the question is regarding a very important mind symptoms, and this symptom will sometimes also come in your practice. It's a very common symptom actually, being affectionate. There are some personalities who are very affectionate personalities, very affectionate, very loving, very caring. And in those personalities, it's an innate character basically to be that. And in that, there are a lot of other rubrics where the child wants to be hugged, wants to be kissed, or the child returns the affection, or the person returns the affection. There are a lot of other remedies and all. So whenever you find a personality which is very affectionate, you have to think about immediately 3-4 remedies that should come to your mind. One of the cases, I had a very interesting case of a COVID case where the child had fever. The patient had fever, a lot of body ache, pain in the head, and suddenly because of fever, the patient wanted his son with him and wanted to caress him and wanted to cuddle him, but he could not because he had COVID. So these were the symptoms, and very interestingly, what happened because of this symptom, the patient wants to be caressed and cared and hugged. I gave a simple remedy, belladonna, and belladonna worked. Belladonna 1 ml, I gave 2 doses, and within 6 hours, the fever came down, the headache came down, and the patient was absolutely fine. Simple symptom, affectionate, wants to kiss and cuddle the child in fever. So these are the symptoms which you have to actually get from the patient. You have to see from the patient actually what is the symptom of the patient. So affectionate, it appears to be a very easy rubric, but when you take that rubric in your practice in prescribing, it gives you fantastic results. Hello, Tony. So first of all, think about remedies like phosphorus. Think about remedies like arsenic, pulsatilla, natrum mure, Nux also. You'll be surprised. Yeah, Dr. Babel, welcome. Dr. Madan, good afternoon. Even Nux is a very, very affectionate personality, And whenever Nux comes to, whenever I'm teaching Nux or I'm thinking, it's a very, very important remedy in your practice, Whatever symptoms you have seen in Nux will relate to today's day-to-day practice. Loss of sleep and working days, day in, day out, loss of sleep, night watching, elements from a lot of things Naxomica is covered with this in today's world. And of course, phosphorus, a very interesting remedy. Phosphorus, a patient returns affection. Whenever you are prescribing a remedy to a patient and you don't charge to the patient, surprisingly that patient returns that affection. In clinical way, I've seen. Of course, you give something in return is something which is quite very, very common in India. But then a phosphorus patient, always remember, returns affection. So it's a very important symptom of phosphorus, also returns affection. And there are a lot of other symptoms of phosphorus. We can go into the detail of phosphorus also today if you want. But if we have some questions, we can start. Okay, there are only questions on WhatsApp, not on the YouTube. So a phosphorus personality, remember, delicate eyelashes. Now, don't always look for the eyelashes, whether they are delicate or there is a lot of fine blonde is there, red is there. A phosphorus personality is as a whole a very delicate personality, delicate personality. A delicate personality means he is very oversensitive to all the senses, to all the external impressions, light, noise, odors, touch. That is a very important remedy, phosphorus. Hello, Dr. Shoaib, late by 8 minutes. That is phosphorus personality, And as I told you, hello, doctor, as I told you, persons who grow too rapidly, persons who grow too rapidly. And how will you judge a person who grows rapidly? A very, very important symptom of phosphorus, of sulfur, of calcarea phos, of ferrum. But how will you know that the patient has grown too rapidly? See, it's an important symptom but difficult to interpret. How will you interpret this symptom? I told you how to interpret in my previous YouTube. If you remember, anybody? Stretch marks. Yes, very well. Very well. So when the body suddenly develops, suddenly the skin stretches and you feel that stretch marks are developed. And in that case, if you suddenly feel that the child has gained height or body, and stretch marks are there, a very, very important symptom of phosphorus. Suddenly inclined to stoop also, that is also phosphorus. But suddenly inclined to stoop, think about sulfur first. In phosphorus, remember, anemic personalities. And one thing what of phosphorus is morning diarrhea. बहुत बार आपको lot of time the patient comes to that I have problem of diarrhea. I have problem of diarrhea. It is since years now. Don't take care of that, but treat me these elements. This is a phosphorus personality. Morning diarrhea, nervous personality, and desires to be magnetized. This is a very, very important symptom of sulfur. And you know the stomach symptom of sulfur, the stools of sulfur. I'm not telling that. One more important thing in today's world of era of COVID, sulfur is a very, very interesting symptom. A sulfur patient cannot talk. Tell me why. Tell me why. Because there is a lot of rawness in throat, there is a lot of dryness in throat, there is a lot of soreness in throat, there is roughness in throat, and there is, because of that, the patient cannot talk. And most of the time, which remedy comes to our mind? Anybody? Which remedy comes to your mind? Whenever the patient comes and tells you that there is a lot of rawness and soreness in throat, we never think of phosphorus. Or if we think of phosphorus also, it comes very, very last. Which remedy comes to our mind? Causticum. And because causticum is taught in such a way in school, college, seminar, everybody will first think about causticum. And when causticum fails, you're confused what to do. Phosphorus patient cannot talk. The larynx is so painful. It is painful, it is dry, it is raw, and it is rough. A very, very important symptom of phosphorus. Clinically, how will you see when a phosphorus starts talking? Sir, actually, I have pain in the throat. He will not be able to speak. That is a phosphorus cough, and so many symptoms, so many cases I have seen in today's COVID world treated and cured with phosphorus. I told you a very interesting case of phosphorus, of one of the case which was admitted in the hospital where there was stiffness in the lungs, the lungs had to be rubbed. That was phosphorus. The same patient, difficult in speaking, cannot speak because the throat is very rough, raw and dry. That is also phosphorus. If you have some symptoms, if you have some questions, you can start asking. Otherwise, I'll continue phosphorus and the time will be over. Again, phosphorus is very, very close. Yeah, so please guide something about male infertility, 20% of quantity motility. Please comment. Whenever, of course, in today's world, if I see my practice also, there are lots of cases of male infertility. Lot of cases of male infertility, and the count of sperm is definitely decreasing. I may have seen very few cases where the count of sperm is above 70 million, 80 million. In many of cases, the sperm count has been very less. Now the question is why there is a problem in male fertility, why the sperm count is going down. First of all, in today's world, I told you, today's world of Naxomika, no time to eat, no time to have rest, no waking time, no sleeping time, work. Because of this competitive world, the body has to maintain the state of health, maintain the state of energy, so that you are not left behind. Most of the cases I have seen in my practice, because of that, the sperm count is going down. Second, if the sperm count is going down, do think about first the primary cause. Just test the testosterone. How is the testosterone? If there is a problem, then make sure that that level is maintained. Second, the sperm count can also be reduced if there is a varicocele. The passage of the sperms has been blocked. Varicocele is there, grade 1, grade 2, grade 3 also. If it is there, first try to treat that. Third comes, everything is normal, still the patient has a problem. Then you think about this world where he has no time to eat, drink, or calm himself. Work, and work. These three are the main causes you have to find out. And in male infertility, always think whether the male is having an inferiority complex or the male sees that he has to perform in life, otherwise he'll be left with he'll be left behind. And how will he face the world? What will he tell to his wife? What will wife think about himself? This is the fourth cause where I've seen the patients suffer from male infertility. Still, 20% count, if there still the patient can conceive, make sure that the motility of the sperm is good. If the motility and the morphology of the sperm is good, then he can conceive even if the sperm count is less. Yes, Dr. Mishra, good afternoon. Dry cough starts every day at around 6:30 p.m. evening till 9:30 p.m. without sputum, no other complaints. Walaikum salam, Dr. Sartaj. Now see, Disha, 6:30 it starts and 9:30 p.m. in the evening. It is a very precise modality. But in many cases, clinically I have found in my practice, it is not so important. First of all, this modality you can take it as evening. And if you take evening modality, there are lots and lots of remedies. First of all, understand whether the patient is suffering from a spasm. Spasm. If there is a spasmodic cough, then you have to see why there is a spasm. To answer you very simply, if the patient is suffering from cough, it is a very dry cough, especially in the evening, then there are lots and lots of remedies. If you see in a mater medica, exactly the time is not given that 6:30 to 90, but definitely we have timing from 6 o'clock or 7 o'clock until midnight. And if you see, the remedies are Hiparsulf, phosphorus, Rustox. Very, very important. And if the patient tells you that neither he can sleep nor he can lie down, then just think of one remedy, and that is Sticta pulmonale. Sticta is a very, very, three remedies are very, very useful, which are not used in our day-to-day practice. You know why? Because there are a lot of other remedies which have been taught. Do think about Sticta, Mephitis, and one more remedy. Sticta, Mephitis, and Colinsonia. These remedies basically are not prescribed, but because you cannot differentiate this remedy symptom. But Sticta is a very, very interesting remedy. Of course, Rumex is there, Sticta is there, and Mephitis is there. These three remedies are very, very important for dry cough, especially if the cough comes from the throat. Of course, you have you have symptoms of Mephitis, which can come from the lungs also, but I have seen this in my practice. So these are the very, very, in fact, if I tell you something about Sticta, if we have time, I think we have a lot of questions, but still I'll tell you one thing. In Sticta pulmonale, a very, very important symptom is tickling in the pharynx, and dry cough which prevents sleep, and inspiration aggravates, a very, very important symptom of Sticta pulmonale. I hope you got that. Madhuri says, sir, please throw some light on profuse bleeding due to menses in lactating women. See, first of all, if the patient is suffering from menorrhagia, of course, if it is classically during lactation, I would not take that, but I will basically think for metorrhagia. Now, if there is a metorrhagia, we have lot of remedies, but the remedies which you must think about: Trillium pendulum, Thalaspi bursa pastoris, Pulsatilla, Murex, Millifolium, Irigeron, and Ficus religiosa. These are very, very important remedies for bleeding. And of course, don't forget China. So, remedies for increasing growth of plants. So, fantastic question, Dr. Gupta, and I'm very happy that you asked me the question, because I use lot of remedies in my garden, in my botanical garden, in my garden too, for plants. And you have asked me a very interesting question for growth of the plant. Write down, the remedy is lecithin. I use lecithin in my practice lot of times for growth of the plant. First is lecithin, second is cod liver oil, 6 potency, and third thyroidinum, 6 potency. Of course, I'll share some cases, where the amniotic fluid of the in a pregnant lady was less. So doctors told that if it goes down, then we have to supply amino acids and put a drip. In that case, I gave that lady lecithin 3x tablets. In I think about 8 to 9 days, the fluid, amniotic fluid, rose to normal. Lecithin 3x. So do think about that remedy. 26-year-old post-delivery abdominal pain during the crying. History of blood loss during delivery. How to manage, sir? Ignitia, China, Colossian, but temporary. Now, see what is your case post-delivery abdominal pain. So first of all, you have to understand if there is a trauma because of delivery. And if there's a trauma because of delivery, then the remedy absolutely changes. If there's a trauma in the abdomen, in the lower segment of uterus, there is pain. So in these cases, you have to see remedies which are more than this. Don't always think about the bleeding remedies, because if there is trauma there, then the remedy changes. Then you have to think about remedies like, okay, I'll just come to that question, Dr. Babel. So if there is bleeding, think about belly spur. Very, very important remedy, the secondary to trauma. I told you one remedy which was very common, if you remember, Hirudo, Hirudo. Hirudo. Third would be lachesis, and fourth would be phosphorus. Okay, but think about the injury also. Only injection gives relief. Oh, if injection gives relief, then the case is very severe. Do think about an lachesis, phosphorus, arnica. Lachesis, phosphorus, arnica. Dr. Mishraji, eyes red, cloudy looking after severe UTI, pus cells plenty. एक बार हमने आपको बताया था मिश्रा जी, एक केंट्स मटर मेडिका के अंदर एक रेमेडी इसमें लिखा हुआ है हीमोराइडल आई, आंख में पाइल्स हो गया, ऐसा होता नहीं कभी, बट डॉक्टर केंट ने लिखा हीमोराइडल आई. सो आप सोचिए, उसके लिए रेमेडी है एस्कुलस हिप्पोकास्टिनम फर्स्ट, सेकेंड फॉस्फोरस, थर्ड बेलोडोना, और फोर्थ रेमेडी हालांकि बहुत रेयर है, बट आप कोशिश कर सकते हो उसको यूज करने के लिए, वो है नेफ्थालिनम. सर प्लीज सजेस्ट कॉन्कोडायमा. Concordaima, I always say, a very, very irritating and a very, very irritating also, and it gets relief after some time, But do think about our remedies: hypericum, rustox, arnica, calcarea floor, and sulfur. Especially if the patient complains that when I get up from my stools and the pain starts, think about sulfur. Cor, please write. Dr. Bawal added Corallium rubrum. No, Colensonia. It is, Dr. Bawal, it is Colensonia. Colensonia. A video on agrohomeopathy? Yes, I will try. As such, Dr. Gupta, I'm not getting time to take Google Meet, There is a lot so from webinars, but I'll try to get you that remedy. Delivery in normal blood transfer. Okay, normal diagnosis. Okay. So, Dr. Shoaib, that means the body is not able to face the challenge of the pregnancy. So you have to think about lachesis, phosphorus, and one remedy I would add, Dr. Shoaib, that is millefolium. It has given me a lot of good results. And to add to that, you can do think about remedies like adrenaline. That also works very well. For the plants, yeah. For the plants. No, it was cod liver oil. Cod liver oil, Dr. Babel. Cod liver oil for the plants. Patient had her menses after 5 months, thinking she might be going to menopause state. Profuse 78 days, too smelly menses, body also very smelly. She's obese person. Please comment. Okay, so basically we'll be understanding this case in where the menses are offensive. So very offensive. Now I hope, as I always tell you to my all students and all, if the patient tells you that the menses are offensive and she cannot comment how is the smell, don't keep asking how is the smell, because in our homeopathy there are so many types of smells. So offensive menses. Offensive menses, if you have to prescribe a remedy, do think about one or two remedies. But in your case, Dr. Madan, you have specifically written one thing, and that is the body is also smelly. Is it during menses only the body is smelly, or as such also body is smelly? Matlab, is it the body is smelling only at the time of menses, or like that also? Yes, Dr. Madan. So I'll give you both the answers. Sometimes body odor is very smelly at the time of menses. That is something different. But in your case, Dr. Madan, if this is the case, do think about these 3-4 remedies which have got very good results. First on the list should be creosote. Second is carboveg. Third is bryonia alba. Fourth is sabina and sickle core. These are the fantastic remedies, 5 remedies, which will in many cases help you in treating these conditions. Agrohomeopathy, Dr. Sir, a case of Shankar treated in 2018 gets cured, but again it occurs in 2011 in spite of sexual history. Yeah, so one thing, it is very common that if you have treated that case of Shankar, just see that the symptoms are same and you can repeat the same medicine in about one potency higher to what you have prescribed before, and then see the results. Sir, remedy for melasma of female of 40 years. Yeah, so such a bad condition, melasma, and again I will tell you, again I can tell you, I have also a lot of cases, but I will be very frank, I have been not able to cure few, maybe lot of cases in these conditions. But let me tell you that there are some remedies which are very good and useful in case of melasma. Be very sure to differentiate the color of melasma. Dr. Gupta is there. Is it black? Is it ashy? Or it is bluish in color? Because the remedy which I am going to tell you are absolutely different what I have seen in the practice. When it is blackish in color, do think about China. One remedy which is very rare, please write down, Onintho crocata, where the discoloration is blackish. China, Onintho crocata, Oenanthe, crocata, Crocta, crocata. If it is ashy, it is ashy in color, think about plumbum metallicum. Think about phosphorus, and one rare remedy, morphinum. Okay. Third part, if it is bluish in color, do think about lachesis, camphor, ipecac, carboveg. So these are the 3 conditions where you have to understand and then prescribe, and believe me, you will definitely get good results. So if the the one part I have told you something about Dr. Madan about that menses problem. Now, if the patient tells us that the body odor is also bad, if the body odor is also bad, Dr. Madan, please write down. You will get, everybody write down in your books. These 3-4 remedies will give you very good results. No philosophy, just the results. Soranum, pyrogenum, syphilinum, sulfur. In fact, Dr. Madan, if the patient comes and tells you during menses, my body odor is bad, please close your eyes and think about only 2 remedies. First is soranum and second is sternum metallicum. There are 2 remedies in our Mater Medica where it is written even after washing, Even after applying soap, liquid soap, when the patient comes out from the bathroom, still there is body odor. Write down in your notes, there are only two remedies very important. The first is Lactating, second is Medorinum. Do write down. I hope everybody got some idea about the body odor remedies. Very, very important, I hope, Dr. Madan, your answer is fulfilled and you're happy with the answer. What to repeat? Repeat. I hope you got the answer, Dr. Madan. Body odor too. No, see, body odor too much in heat, then I feel the generalized medicine, these 4 5 medicines are very important. But if this is not true, and then you have these type of symptoms, I have told the remedy where the patient cannot wash his body, still there is smell. During menses, the body odor is bad. Or you can say where the body odor is generally bad. Think about soranum, syphilinum, sulfur. These are such wonderful remedies, These are such wonderful remedies. Please don't miss out on these. And if you have any problem and you still can't get a relief, then you have to think about in terms of this line, for dark circles, Dr. Gupta, it would be the same which you think in case, see, dark circles, let me be very frank with you, don't give it is always because loss of nutrition. There is no nutrition in the body. There is no nutrition. There is no antioxidants. There is no fruit in the diet. There is no sleep. There is no water content. And there is a lot of social media exposure. That's why there is a lot of black under eyes are very black. Don't give medicines. Give a lot of advise him for sleep, water, fruits, and diet. Okay. And now one, I think. One question was, I think it has gone up. Sneezing, yeah, sneezing. One question was, that's a lot of sneezing. Do think about ammonium carb, oriendo, histamine are 3 very, very important remedies which I have found very useful clinically in my practice. Okay. Body odor too much in the heat, body odor too much in the heat, I would say, first of all, take that as normal, because in the heat, then what happens, who has asked the question? I'll just be mingle. See, body odor in heat, that means there is perspiration. So you have to think about perspiration, when the perspiration is offensive. And there are lots and lots of remedies where the perspiration is offensive. So you can go and have a look at so many remedies, if I would like to tell you some remedies that comes to my mind, the first is thuja, sulfur, silicea, nitric acid, Merxol. Okay, let us go further. Body perspiration too bad, patient works as driver and yeah. So this is a very common problem, and this is a very common problem, and the problem is that you cannot directly tell upfront to the driver. So go and you're smelling bad. That's what I was telling you. The remedies, think about thuja, think about silicea, think about petroleum, mercury, sulfur. These are remedies which you should prescribe. Now, some points where you have to ask. Now, you can't ask the driver, sometimes. I have an experience where I had such a driver. So, you can't ask some symptoms. No, how will you get to the remedy? I'll tell you a very interesting case, I had a driver, so look at how does he drive. Whether he is fast, whether he is slow, whether he is jerky, whether he does not speak while driving, he does not clean the car. These all symptoms, these all symptoms will guide you to the remedy. This is what I have seen in my practice. This is how, without asking questions also, you can prescribe the remedy. Sir, I got a patient complaint with sleepless night with sensation of ice cold in feet, less thirst, no weakness, appetite, good stools and normal. Yeah, so a very, very interesting question. Okay, patient Yeah, my observations are good, and I hope that you also look at that observation and are able to prescribe medicines. So I see coldness of feet. कभी कभी पेशेंट आके बोलता है कि जब भी व्हेन वी गो टू स्लीप माय feet becomes absolutely icy cold. So what to prescribe? Remember one thing. Remember one thing. If you get this patient, I had a case, a very interesting case of migraine, and immediately when the patient told me this symptom, I just did not take the case. I just prescribed blindly one medicine. Of course, this is my experience. Okay, I prescribed phosphorus. I prescribed phosphorus. When the feet are very cold with sleeplessness, phosphorus, carbo-veg, and I think nitric acid are very, very important remedies when the feet are icy cold and the patient cannot sleep. I'll go a bit further, Dr. Sanma. Some patient complain that the knees become very cold and the patient cannot sleep. In that case, I have used many times only one remedy, and that is chelidonium. Chelidonium. There was one case where the patient told that whenever I take something cold, मैं जब ठंडा पानी रात को सोने, whenever I am going to sleep and I go to the party and I have chilled milkshake or chilled slush, she answered, cold, I cannot sleep. And the remedy, it's a very, very rare remedy I have used in these cases, and that was Jatropa. 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 मिश्रा जी ने पूछा है हाइलोरिक नोसोड के बारे में थोड़ा बताएं. एक्चुअली हाइलोरिक नोसोड, एच पाइलोरिक नोसोड जो है ना, ये मैंने बहुत यूज़ किया है मिश्रा जी. जब भी हमारे पेट की तकलीफ होती है, बहुत क्रॉनिक एसिडिटी है, बहुत. सर इज दिस पॉसिबल और द फॉल्ट इज ऑफ डॉक्टर प्रिस्क्राइबिंग? जस्ट अ मिनट. ओके. सो क्या बोलते हैं, तो उसके टाइम पे मैंने बहुत यूज किया एच पाइलोरी को, लेकिन मैंने एच पाइलोरी हमेशा यूज किया है एल पोटेंसी के अंदर. जब भी पेशेंट बोलता है बहुत क्रॉनिक एसिडिटी है, या पेशेंट बोलता है बहुत अंगार हो रही है, या पेशेंट बोलता है मुझे बहुत घुटन समान लग रहा है, तो कभी कभी मैं एच पाइलोरी रेमेडी यूज करता हूँ, और इंटर करंट भी यूज करता हूँ एच पाइलोरी, लेकिन एल पोटेंसी में यूज करता हूँ मैं. सर इज दिस पॉसिबल और द फॉल्ट इज ऑफ डॉक्टर्स प्रिस्क्राइबिंग? Sir, my brother complains of severe cold whenever he takes homeopathy. He's age 11. He's having cold since many years, and whenever he takes homeopathy, he's Dr. Gupta, ये आपको बहुत this will be very common problem that the patient, lots of patient comes and doctor sir, whenever I take your medicine, no, I cannot eat. Whenever I take medicines, no, I cannot sleep. Whenever I take your medicines, no, my headache starts. In that case, you do one thing, Dr. Gupta. Give placebo, give Phytum, and ask your brother to take it. If he still gets sneezing, that means it is more of psychological. So in this case, this is the case. That means the patient's symptom is, the patient is very impressionable, one rubric, or the patient is very much superstitious, the second rubric. Did you get? How just by this one symptom we can get rubrics? Did you get? So superstitious, like medorinum, like conium maculatum, like tuberculinum, like calcarea carb, like zincum metallicum. Superstitious और impressionable, मतलब कुछ भी हुआ मुझे तकलीफ हो जाती है. Susceptible to everything, like carcinosin, like staphylococcus aureus, like iodum, like ureatrum. So these two are very, very important symptoms. Okay. Okay. Thank you, Dr. Gupta. You got my point. Thank you. Good afternoon, Dr. Kocher, Dr. Shamils. Body odor of children. Now, see, only body odor of children, whatever I've told you about the body, the same medicines you can think about. You can think about sulfur. You think something about the child, whether the child is very tall, whether the child is fair, the child speaks very fast, speaks very slow, he is good in studies, in which subject is good. So every time you have to ask some, see, there are a lot of remedies for body odor. I cannot pinpoint a single remedy. So there are a lot of other symptoms, so you can always think about and then get to the remedy. In which form do you use placebo, sir? How? I give plain pills, 20, 10 number pills, 20 number pills and all, and I keep changing. Some if I know I've given him 20 number pills, I'll give 40 number pills, and I'll give some uh, liquid phytum, discates. Keep changing the phytum, so it's okay. This will basically affect your practice for 5-6 years. That as you develop a grip on your patient, then nobody will ask you about that. So it's the initial practice that causes a problem, because the patient thinks that, sir, you're giving me the same medicine every time. It's like that. But as you go in practice, as you go in your confidence, and the patient has faith in you, this will take liquid, plain liquid, sometimes water also. Distilled water also I give sometimes plain. So in which form? Okay, thank you. Got your point. Good afternoon, Dr. Raki. So I hope you got the answer. Next question. So I'll show you one case of cholesterol. I was last time I told you. See this report. Cholesterol 268. Did you see the report, everybody? Cholesterol 268 before treatment. Again, somebody told the patient that if the cholesterol is so high, don't take a chance. So the patient repeated the cholesterol after 3 days. It came to 244. From 268 to 244 in about 3 to 4 days. Still it was high, so I told him to repeat again. After 1 week or after 8 days, the cholesterol came to 182. So this is how in homeopathy also, just by knowing a constitutional remedy, see how the cholesterol goes down, 268, 244, 182. Gradually. It goes gradually. But you know that the flow has to come down. Once the cholesterol came down to 244, I was sure that now the patient is basically on the healing side. It goes gradually. If your prescription is light, all the metabolic disorders like thyroid, sugar, BP, or cholesterol, they really start giving results in the first month only. Of course, if the patient is suffering from the problem since years, then it takes some time. But I have seen that the downtrend starts very fast with your medicines. Gradually, everything starts coming down, and the patient is also happy. The problem is that the neighbors, the other physicians, they say, oh, cholesterol is very high, you'll get a heart attack, and the patient becomes panicky. So whenever you're prescribing for cholesterol, do think and tell the patient that it is coming down. Just wait, don't panic, and tell him to just take a report after a week's time, so that if the downward trend starts, he's happy and everybody is happy. Okay, I hope you understand that. And for treating cholesterol problem, blood related problems, I have told you how to enter the case. In not every case, but in most of the cases I have seen, one rubric will help you to enter the case of cholesterol or CAD. Which is that rubric? Anybody? Yes? Yes, very nice. Grief. Grief is a rubric where everything is just settled in your body. Everything keeps settling down, and cholesterol, the viscosity of blood increases, the solid content of blood increases, and the patient lands up in these type of problems. So whenever if you get a cholesterol case and if you find this rubric useful, do comment, so that I also know that whatever I am teaching basically is helping you in your practice, and what concepts I have in my practice are right. Okay. Next question. Some questions have been scrolled up, so let us have few questions more before we can finish off, or it is already 45 minutes up. Okay. So can we have some questions, or it is okay? What's up class discussion? What's up case discussion? Okay, I think there are a lot of cases of being put on WhatsApp, but those are very interesting cases, very, very interesting cases. I think a case of arthritis or case of migraine. I think today a case of knee arthritis, knee pain has been put. And see, I have put a very, very interesting rubric, a rare rubric, fear of osteoporosis, and I prescribe calcarea carb. So this is how you have to learn from your practice. So there are a lot of cases I have put now since a few days. Chronic kidney disease of today's case. No, I have not seen that case. I'll see in the evening basically what case I have been put, and I'll then discuss that case. Okay. Dr. Anja Smith says, good afternoon, myocarditis from Pfizer vaccination. Okay. Would you recommend the nosode for the vaccination? Which nosode? See, now basically what happens that we are basically, Dr. Anja, we are basically treating the after effects of vaccination, especially related to heart muscles, myocarditis. So if you have a nosode prepared from COVID, well and good, you can always see, but still I would suggest ask few more symptoms apart from myocarditis. What are the symptoms the patient is suffering from? Symptomatologically, he may be very close to thuja, vaccininum, carbon. But of course, if you have the nosode of COVID-19, give that first. And let me tell you, in this COVID third wave, I have cured hundreds and hundreds of patients with the COVID-19 nosode which I have made. Wonderful results. In one day only, the symptoms come down. By 2 days, absolutely fine. Works wonderfully in 30 potency. If you want some of the nosode, I can courier you 1 or 2 bottles. You also can try in your practice and you will get some good results. You can share the results with me. Very good, Dr. Anja. So just ask few more symptoms and you can get back to me on my WhatsApp. Privately also, I'll basically will be very happy to help that case of myocarditis. Okay. Yeah. So here in our place, almost all complaints of patients are same as mild. Yeah. So yeah, Dr. Sama, that's what I was telling you. In here also, everything is same. So I have given lots and lots of cases of COVID-19 30 potency. Everybody has responded to my treatment. Everybody, let me tell you. And you can also think about Eupatorium perfulitum also has been very good. Those patients who are basically out of India, in Europe, I have in Germany and all, in Italy and all. So I could not send them the nosodes. In those patients, Eupatorium perf has worked very nicely. Next question, eruption on lower. Yeah, so Dr. Babel. Eruptions on lower legs, itching, scratching, and continuous even come from. No pharmacy will give. Just a minute, okay. Talking, he don't have money. Okay, so Dr. Madan. So if the patient is always talking about money and he is very miser, avarice and all, you can say that miser and all. Think about sulfur, silicia, pulsatile arsenic. That's all. No, you can't order for COVID-19 vaccine. I've made it myself in my personally I've made for myself, so I can send you few bottles. You can try in your practice whether it works or not. I've made it for myself, so it's not available in the market, And don't tell also anybody because you can't make the nose food. But I have made it and it's working fine. I can send you some of the few bottles. You can try in your clinic. You can send your address to me and I'll courier some files to you. See whether it works in your practice. Okay. Mishra ji, no stuff up, talking slow against 8 साल 30 coughing, now picric acid fall to permanent cure. नहीं तो मिश्रा जी इसको आप ध्यान रखिए जब भी आपका नोज बंद है आपको नोज में बहुत ज्यादा ऑब्स्ट्रक्शन है तो पिक्रिक एसिड आपने काय को सोचा पिक्रिक एसिड मत सोचिए आप लिख लीजिए दवाई इसको आपको ट्राई करना है सबसे पहले सोचिए सैम्बुकस नाइगरा दूसरा रेमेडी सोचिए टुक्रियम मारम वेरम तीसरा रेमेडी सोचिए बहुत इंपॉर्टेंट है वो है काली बाइक्रोम और चौथा रेमेडी है ऑरम ट्रिफाइलम ये 4 रेमेडी बहुत इंपॉर्टेंट है ये आपको सोचना चाहिए इसके अलावा बहुत रेमेडी है सैंगोनाइट्रिकम है एग्रिफस नट है लेमना माइनर है बट ये 4 रेमेडी सैम्बुकस नाइगरा ट्यूक्रियम मारम वेरम काली बाइक्रोम और ऑरम ट्रिफाइलम बहुत अच्छे रिजल्ट देते सो आई थिंक नाइस टॉक आई थिंक वी शुड नाउ फिनिश ऑफ दिट गुड इवनिंग डॉक्टर अंसारी बहुत लेट ज्वाइन किया आपने sir, yeah, you send the address and I'll I have to see. I'll send you some of the files. You try in your region and see if it's working or not. Okay, Dr. Anja Smith. Okay, it's a question from Dr. Babel to Dr. Anja Smith. Are you from Germany? So you can always answer. Dr. Babel Jabin. I don't know. Okay, you will not get it because I don't know how to get that, but I have made for myself. So I can't tell you, Dr. Madan. If you are Dr. Madan, are you from out of you are from out of India? I can't send courier out of India. It's very costly, and by the time it reaches, I think the wave will be over. But I'll send to Indian doctors. Maybe you can try and see whether it works. So everybody, Dr. What Dr. Smith has written, I think only Dr. Babel can read that because I think it's in German language. I think. So let us sum up today. A very interesting YouTube. I enjoyed teaching you, and I enjoyed sharing with Dr. Gupta, Calibacterium aurum tri, and the fourth, Calibacterium tucurium aurum triphyllum, Sambucus nigra. डॉक्टर यादव ऑटोइम्यून डिसऑर्डर्स एक बहुत बड़ा टॉपिक है, मैं बताऊंगा नेक्स्ट यूट्यूब में, बिकॉज मैं अभी बंद कर रहा हूँ, मेरा दूसरा एक वेबिनार है सैम्बुकस नाइग्रा. या डॉक्टर अंसारी से 6 months डायग्नोज मस्कुलर ट्रोफी, चाइल्ड नॉट मूविंग. या सो डॉक्टर अंसारी आप भी ओके. सो डॉक्टर अंसारी, ये काफ़ी इंटरेस्टिंग केस है. आप मुझे पूरा केस भेजिए व्हाट्सएप पे, मैं आपको आंसर करूंगा. सो डॉक्टर बाबल एंड डॉक्टर स्मिथ, यू कैन ऑलवेज कोऑर्डिनेट एंड टॉक टू ईच अदर. ओके, so thank you so much. Thank you everybody for joining, and thank you for your time.